All
Um,
right, guys.
a- all right, guys, welcome back to another episode of In the Nick of Time. Today, I'm joined by a fantastic guest from Baltimore, Maryland, the best city in America, where I was not born but raised, and a huge Ravens fan. Dr. William Kang, thank you for taking the time to make a guest appearance on this podcast.
Honored to be here. Big fan. Great to be here.
I appreciate it. I appreciate it. I followed your stuff. I loved your videos. You have some really funny videos about anesthesia, and I love poking fun at anesthesia too. So I really enjoyed that one. Before we even start, I really just want to say I saw the video where you did the consult cardiology at the end of it. Thought that was absolutely hilarious because that was something that we tend to do all the time. And I really appreciated you bringing a little bit of light and humor to a situation that causes so much anxiety among surgeons and anesthesiologists every single day, I'm sure, across the country.
Yeah, clearly that responded to a lot of people, but there's always this kind of sibling rivalry that anesthesia surgeons have, and that we love each other most of the time, but sometimes siblings get into it a little bit.
Yeah, yeah, absolutely. And for everybody who's watching, most of the doctors out there that go into anesthesia at some point wanted to be a surgeon and then decided that the time commitment probably wasn't worth it. And so they shifted, still in the operating room, but a little bit on the other side of the drape. But so I found humor in that and I love poking humor on it. Let me give a quick introduction to Dr. William Kang. He is a board certified orthopedic surgeon in Baltimore, Maryland, affiliated with St. Agnes Hospital. Fantastic hospital, by the way. I've been there before, and has been practicing for 11 to 20 years, having graduated from University of Central Florida College of Medicine. His expertise include treating conditions such as bursitis, rotator cuff injuries, arthritis, hip, knees, broken bones, and now he's shifting toward a little bit of trauma, which is a little bit of my little bit of my slogan, which I catch a lot of flack for. Dr. Kang, I don't know if you've seen some of the comments, but very often after I say board certified trauma anesthesiologist, some of the nerds out there will be like, "That's not a real specialization." I'm like, "It's okay. It's just a title. It's not
Right.
like I'm presenting at the American Association of Anesthesiologists or something like that." So, Dr. Kang, where does this podcast find you?
Well, I'm in my clinic. I just finished morning clinic, and currently my practice, I'm doing a lot of call over at St. Agnes. So the morning I'm doing clinic, in the afternoon, if there's broken bone to fix, I'll go over and fix it, and usually in time to go home and pick up the kids.
Yeah, yeah. I saw two kids.
Two kids, 6-year-old twins. They're great. They're
Oh
doing
my gosh, I
everything
can only
you'd want them to
imagine.
do.
Yeah, yeah. So how do you balance? So the first question off the bat, how do you balance being an orthopedic surgeon, obviously in a demanding specialty in a city that has probably a lot of broken bones for one reason or another? How do you balance that lifestyle of being an orthopedic surgeon, trauma orthopedic surgeon, and private practice kind of part of it as well? How do you balance the two, and a father and a husband?
Yeah, it's really tough. Anyone that goes into orthopedics is by nature really ambitious, really competitive. So you want to be that busy guy that's doing 500 cases a year. But at a certain point, I found that I had to make a choice. And I actually chose to put my family first. And I haven't regretted it at all. I probably could do 100 to 200 more cases a year if I really pushed it, but then I would never see my kids. So now in the point in my career, I got young kids. I really make it a point to try to be present because a few short years they're going to be out and they don't want to hang out with me anymore. And then I'll pick it up and pick up the RVUs.
Yeah, I really appreciate that perspective because so I'm married to a cardiac surgeon and she's busy. She's in the first year of her as an attending and all that kind of stuff. And I took a step back, to have some more time with our son. And I think a lot of especially new grads that come out of residency and fellowship, when they have young children, they have to make this tough choice between, getting the reps, getting the time in at the hospital as an attending, and then getting the reps and the time in as a husband, as a wife, as a parent. And so it's a very difficult time for people to kind of decide, how did you make the choice, or what really played into your factoring your decision to kind of give a little bit more emphasis to your kid, which I totally respect, by the way.
It probably started in residency. And so I was dating my now wife at the time, and I did my residency in New Orleans. And I was trying to be this superstar chief resident. I was making the call schedules. I was sort of putting myself on Mardi Gras and those kind of things. And at a certain point, my wife sort of pointed out that, the hospital gets all your time. You have to choose us sometimes. You got to choose your family sometimes. And it was sort of a paradigm shift in the way I thought about my career and my life. And I knew sort of intellectually that that was the right answer, but I never really committed to it. And so somewhere between chief year in residency and then my first few years in practice, I sort of made a conscious decision to put them first, choose them first.
I respect it, and I appreciate it. Honestly, that's a very refreshing view. You see a lot of surgeons get caught up in the job, and it's hard to break that kind of thought process. And collectively, I think as a society, we're kind of moving toward recognizing there's a balance between being at home and being at work, and they're two distinct things that one shouldn't really affect the other, because it's all important. Raising kids and all that is what for me, it's the purpose why we're on this planet Earth. So I truly respect that. Now, I kind of want to shift this toward orthopedics because you are one of the funniest orthopedic surgeons on Instagram, TikTok, social media right now. Tell us a little bit about why you chose orthopedic surgery. Was it because you really like carpentry, or you actually enjoy the orthopedic side of it? What made you choose?
So I'll tell you the real answer. I chose orthopedics, and it's not the answer I gave on my interviews.
Of course.
This is the true, honest truth. So when I was a third-year medical student looking around the hospital, the orthopedic surgery residents and the attendings, they were the coolest guys in the hospital. They had the most swagger. They had the prettiest girlfriends, and they drove the coolest cars. And they looked like they were having the most fun. And I wanted to be just like them. So it's not the best answer, but that's the true answer.
I appreciate that. I wanted to be orthopedic surgery too. When I was a medical student, that was my first choice. But the hours that kind of pulled me away from it. But I respect that answer because I totally understand it. The orthopedic surgeons typically are the most fit, the most swagger. They have the most respect. They generate the most money, and they live really, really entertaining lives. Some of my best friends are orthopedic surgeons, and they live great lives. And so I appreciate that answer. And I appreciate the refreshing honesty about it. Tell me a little bit about you post a lot of videos, and I was looking through your stuff about study tips and how to study properly for the MCAT, or the USMLE, or even your step exams or board exams. Tell us a little bit about how you went about preparing for your exams, because for anybody who's watching, I mean, it's not just because orthopedic surgeons, they picked like the coolest, strongest, most jacked medical students to become their residents. You have to have really good board scores, and you have to be very, very smart. And so tell us a little bit about your hacks, or what you did to kind of score as well as I'm sure you did to become at the position you're at now.
Now, this is going to surprise you and most people that when I applied to orthopedic surgery, it was with a very low step 1 score. So I was a music major in college. I hadn't taken a science course since high school. I had this whole career as a violinist. So I went into it when science was not natural for me. I was in my late 20s. My brain's not as soft as it used to be. And I maybe had some bad advice and didn't really study as I should have for step 1. So I did pretty poorly, way below average. And so I knew to match orthopedics, I had to crush step 2. So I revamped everything I knew about studying. And I'll tell you, overall, the main difference was when there's limited information, you can get away with just memorizing everything without quite understanding it and not prioritizing what's important and what's not important. And then I knew to crush step 2, I had to have a different mindset. So it essentially comes to prioritizing your information, knowing what's the most important things and studying that the most. The other thing I didn't appreciate was that you need to sleep. I mean, one of my first viral Instagram videos was about the importance of sleeping. And so if you're the type of personality that most surgeons are, and honestly most anesthesiologists are, you think sleep is for the weak. I don't need to sleep. I can sleep whenever I'm successful, that sort of thing. A lot of successful people, even the late great Kobe Bryant, discovered late in their lives that sleep is so important, and that's when you learn, that's when you consolidate. So that's probably the number one key takeaway I took away from that is maximize your sleep, get those necessary reps in, but make sure you're taking care of your body at the same time.
I mean, that's a great answer. That's why I went into anesthesia, because I enjoy sleep so much.
Right. Yeah, you're smart.
And
you made the smart decision.
When I clip this for Instagram, I'm going to say, Dr. Kang, how do you become an orthopedic surgeon? And then it's going to be sleep, if that works for you.
That's it.
Dr. Kang, is it true you were a violin? You played violin, or you had something to do with violin back in college? Or did I just read that wrong?
No, I was a full-time violinist.
Yeah.
Oh, what you have to understand is that I come from a family of doctors. So both my parents were family doctors in Louisiana, and I have three older siblings. I have two older sisters and a twin brother. They all went into medicine. Psychiatrist, pathologist, went to general surgeon. By the time I got to college, I thought, this just doesn't do it for me. I mean, I can't do the same thing my siblings did. I need to do something harder. I need to do something that maybe I don't know if I can do it. And violin is something I was reasonably talented at doing. I was nothing special, but I thought I'd give that a try. So I went for it 100%. I had no desire to be a doctor. So I went to undergraduate, I went to conservatory for master's, and I was lucky enough to win some auditions. So I was working as a full-time professional violinist for a couple years.
That's so cool. I think that's awesome. And that's a lot of inspiration for, any kid who's in college right now is thinking about maybe pursuing something different and then thinking about medicine as well. If you can master a craft, like, I mean, violin is obviously way out of my league as something I could, and I played, I played in like middle school and high school, but it is very tough. So for anybody who's watching this, especially for medical students or residents out there, or thinking, or sorry, college students who are thinking about medical school out there, if you have a major that is even outside the box, I think it's even viewed more favorably now than it was 10, 15, 20 years ago when it was, kind of taboo if you didn't do chemistry or biochemistry or biology as your majors in college. And so that's very interesting, and it's very cool on your part that you were actually professional violinist as well.
Yeah, and it was fun. I mean, unlike surgery training, I would go back and do music all over again. It was a great time. Meet a lot of amazing people. And yeah, and if there are college kids watching, any application process is really a game of getting remembered. You got the stack of applications, hundreds of people with great scores, great numbers. The key is not to be forgotten. So if they can say, oh, that's that violin kid, at least they remember who you are. If you can say, well, that's the kid that played soccer, we can remember him. And that's why being in a non-traditional major just gives you a little bit of an advantage right off the bat.
I love that. I made a video on that, a year ago where I said, how do you get into residency you want to go to? And the number one tip I put on there was just have something memorable about yourself, because everybody's smart, everybody has great letters of recommendation, everybody has the qualifications. But when you're an attending and you only have 30 minutes to meet 6 or 8 people, and then you have 30 minutes to evaluate them and rank them, you really only remember tidbits. And you're like, hey, that was, like you said, the violin guy, or the kid who played D1 football, or the kid who was really into electric cars. And so if you can remember that one fact, and even if you let it be known to all of your interviewers that, hey, I love the violin, or I love working on cars, or, photography of polar bears, or whatever it is, if you have something that you can remind everybody about, then when they go to the ranking, they're like, oh, I remember that guy because he had something. Or I remember that girl because she was really into this or really into that. And that's a really big hack. And I think a lot of medical students don't know that or don't think about that. They just think that, hey, if I talk about anesthesia, or if I talk about orthopedic surgery and how I did 500 research publications on it and on this and that, that's going to be memorable. Sometimes it is, but sometimes if you stand outside the box, that also helps quite a bit too.
Yeah, 100%.
So tell me about your playlist in the operating room then. Is it all violin, or is it hard rock, or is it rap, or what do you got playing?
No, I actually cannot listen to classical music in the OR. I actually start focusing on that, and it's almost a distraction.
Wow.
I usually put on a Spotify playlist of some sort. The one I'm listening to a lot right now is called retro pop, and so it's artists today that just like the sounds of the 60s and 70s, and they make music like that. So I like to keep it upbeat. I like to keep it loose. One of the jobs as a surgeon is to kind of set the tone in the OR. And I think staff in the OR work better when it's a little relaxed. And I know a lot of surgeons, we all work with the surgeons that everyone's a little on edge. I don't think people perform as well. There are times where everyone's got to step it up, and I try to make it a point to say, we're cementing right now, everyone, this is a crucial part of the case. Don't answer any phone calls for the next 5 minutes. We're all here at this moment. But in general, most people work better in a less strict environment.
Hey, I appreciate that. Throughout my career as being attending for 10 years now, nobody's ever said that to me. I have never had a surgeon say, hey, for the next 5 minutes, I need you guys to be present in this space right now. And I think that's huge. Have you been doing that for a long time, or is that something that just came to you, or how do you go about it in your critical moments and those critical surgeries that are, and let me set the scene for you. So for anybody who's watching, there are certain parts of certain surgeries that require the utmost focus in every field, and not necessarily just orthopedic surgery or neurosurgery or heart surgery, but in every surgery, whether it's like a C-section or whatever it is. There's a little portion where even the surgeon themselves has a little bit of anxiety when they do that portion of the surgery. Because they know if it goes wrong here, it could be devastating, could have complications. For in orthopedics, you might not walk right afterwards. So whatever it is, how did you come up with that thought process? Was it one of your attendings, or you just kind of came to you? Because that's awesome, and I would love for that to be more of a thing in operating rooms across the country.
One experienced surgeon told me that master surgeons just have made every mistake you can make. So to be honest, that came from a case that didn't go well at that particular time. And so as a surgeon, as a doctor, as anything you do, it's okay to make a mistake. You just got to learn from that mistake. So I knew going forward that crucial time in that case, it didn't go right that time because of all sorts of reasons. So I made it a point from then on to know everyone to be on high alert, because cases are long. You can have 2-3 hour cases. And if you're a deformity spine surgeon like Dr. Z, 18 hours, 20 hours, which is just crazy. But the main reason I did that is so the anesthesiologist can stop doing the crossword puzzle. Like, Dr. Hasan, you got to stop doing the crossword puzzle for 5 minutes while we submit this. That's really why I did it.
That's true, but it'd be a lot easier if he just sent us a text instead of saying it, because I don't know if anybody actually hears the surgeon say that.
Well, yes, you actually can't hear us. You're not just ignoring us on purpose.
Yeah.
I got it.
That's absolutely true. That is so for anybody watching. That's a hilarious back and forth. Dr. Kang has the really funny videos online that poke fun back and forth, and I absolutely love that. And you did a video about ranking the nicest doctors in the hospital, and if I remember correctly, you did put pediatrics as the top, but you did. I don't think you ranked 2 through 5. So I'm going to put you on the spot a little bit here and ask you, who is 2 through 5 on your nicest doctor list inside the hospital?
Or so definitely anyone in peds. And just from a numbers perspective, if you go into peds, you are purposefully taking a pay cut to do more. So just straight off the bat, they're going into it for the right reasons. So I would say any peds, it's got to be number 1. Number 2, and I hate to even rank them because they're all equally nice, anyone in primary care. It's a thankless job. They don't get reimbursed as much as they could. They're trying to make some adjustments to the RVUs, how they bill, modifications to reward primary cares, but it's probably not enough. So I definitely put primary care. Geriatrics, palliative care, really tough time in anyone's life to deal with that. And those are just angels. You meet them, they're just the best people you meet. 4, I definitely got to say oncologists. And if I could say 4 medical oncologists, 5 surgical oncologists. And so oncologists are around for usually the most emotional time of that person's life. I have to say, I've never met doctors that love their patients so much. So all doctors love their patients to a certain degree, but when I speak to oncologists, they really love their patients, even when the cancer's gone and they have successful treatments. They love just talking about their kids, talking about their hobbies, talking about their dogs, just having a conversation with them. There it is, 1 through 5.
I couldn't have come up with a better list myself. Absolute shout out to pediatricians out there. My mom's a pediatrician, and I saw how horribly paid she was for her entire career. And the rest you're 100% on. I mean, oncology is something that I don't even know if I could do if they paid me an ungodly amount of money to do it, because it's so tough to be with patients that maybe 20, 30, 40% of them you might not see in a year. And so that's such a hard, because a lot of the times the families come to you with hope, and it's right now cancer treatment isn't at an 80-90% cure rate, and so you have a chance of losing a lot of your patients. That's mentally wearing on you day in and day out. And one more I'd like to add to your list, and this is a little bit specific, but there are critical care doctors in cancer hospitals, and their job, at least from my residency and the couple places I've been at that I've seen them, might be the hardest job because you have to manage the critical care aspect of whatever cancer has caused them to go into heart failure and problems with the breathing or whatever it is. To manage that part, but you also have to manage the families and the expectations and the anticipation of what's about to happen, and so you're playing all these different roles of, like you said, palliative medicine, but also oncology, and then also the critical care aspect of it. And you're being pulled in all these directions, and every field has a little bit of anxiety with it as it is in baseline, and to add all three of them, it's just insanely tough. And so I would add that to your list. But aside from that, I think your list is fantastic.
Yeah, I don't think I've ever known that field existed, but that sounds tough. I mean,
Yeah.
I know one decision you have to make when you choose your fields is, do you like taking care of sick people or not? And most orthopedics, we just can't handle the sick patients. But if you're in the ICU and anesthesia, you guys know how to take care of sick patients. That's part of the job.
Part of the job. Let's shift it a little bit to some of the fun stuff. I have some questions for you that I know will drive some viewership. Dr. Kang, I had an interview recently with Dr. Z, and we talked about squatting heavy. Now, you take care of backs, you take care of hips, you take care of knees. I made the point on the podcast, and I've said it several times over the course of the past year, that, in my opinion, after the age of 40, once you get to the age of 40, there is no upside to doing barbell squats heavy because the risk of injury is so much higher, and that you can achieve the same amount of results from doing more, I guess, stabilized movements. However, there is a large contingent of my followers who like to lift very heavy weights and squat very heavy weights as they get older. What's your opinion, being a orthopedic surgeon and someone who treats trauma very often? What's your opinion on that?
Well, me personally, I gave up the barbells. I loved squatting, deadlifts. You just felt like you're really getting stronger when you did that. But like you and Dr. Z, I saw that podcast. I tweaked my back. I hurt my back, and I was out for a couple weeks. And at that night, I remember being on the floor, like lying on my back on the floor. I literally couldn't get up. And so, number one, it's pretty scary. And number two, I appreciated what my patients go through when they tell me that story, that I couldn't even get up. I was laying on the floor. So I don't think it's a good idea to squat heavy unless someone's paying you to squat heavy. So if you're Jalen Hurts and you want to do a tush push and you need to squat 800, Jalen, you squat. But if no one's paying you to squat, you don't squat.
I love that answer. That's that, and I think I left that out of the question. But I said, unless you're being paid for it, or you're a professional bodybuilder or a professional athlete, the upside is just not there. I mean, it's like you said, it's very satisfying to put up 2 plates on each side and do 10 reps of it. And I was there. I was there as a medical student. I was there as a college student. And then I tweaked my back. And after that, I retweaked my back every time. I was like, oh, it's a one-off thing, and I can do it again. To this day, I mean, anytime I had put on a barbell, and I haven't done it for years, but until 5 years ago, every time within 6 months, I would have some sort of injury where it wasn't necessarily the squat motion, but it was the stabilizing of the weights. And every time it happened, I was like, I'm never doing this again. I'm never doing this again. And so now I've changed my weightlifting regimen to do more body weight squats, or doing lunges and that kind of stuff. And just the bar itself is just so risky, in my opinion. So I appreciate that answer. And I appreciate that coming from an orthopedic specialist. You said Jalen Hurts. Are you an Eagles fan?
I'm not. I'm actually a Saints fan. So grew up in Louisiana. So grew up in the time where we were playing Joe Montana twice a year. And then he went down as a kid. I don't want to root for an injury, but I thought the Saints have a chance. But then Steve Young came in and he was even better than Joe Montana. But no, diehard Saints fan. I'm going to have to become a Ravens fan as my kids get older, but we'll get there.
Yeah. Lamar Jackson is a superhero in Baltimore, so it's pretty hard to not root for those guys. Growing up, I was a big Drew Brees, and who was Drew Brees' main receiver? Was it Marcus Colston? There was somebody before Colston, right?
Yeah, Joe Horn was his guy.
Yeah,
during the Super Bowl years, but yeah, Marcus Colston was after that.
Yep, and then the Reggie Bush days, those are fun. I like the Saints. They were fun. And Kamara is great. He's great fantasy running back every single year.
Yeah, unreal.
So, I'm sorry, go ahead.
Yeah, when I look at those quarterbacks you're talking about, how to stay healthy, especially when you get over 40, I always talk about Tom Brady, especially Tom Brady versus Drew Brees and Peyton Manning. And if you look at the two of them, Tom Brady did not lift heavy weights. going back to that whole conversation, if you read his book, TB12, I'm not endorsed by TB12 in any way, but he's got some great ideas that he went for pliability, flexibility, and a very strict diet. And he played at a high level to his mid 40s. And you look at Peyton Manning, Drew Brees, those guys were the heavy lifters and their bodies just broke down. And I don't think it's an accident.
So that's interesting. What's your opinion on, and specifically not necessarily just sports, but just in general, having a healthy aging as your spine, your bones age? What kind of supplements are you eating day in and day out? What do you find that help you out a lot, and what do you find that's kind of people say works but doesn't really work?
You know, I haven't done any supplements, believe it or not. Now, I have a wife who's really healthy. I mean, she actually hates junk food. I grew up Korean parents, a lot of spam, a lot of ramen, a lot of jack mackerel in a can. So I grew up on that stuff and I love it. But since we've been together, we really cleaned up our diet, and we're eating a lot of fresh vegetables, a lot of fresh fruits. I do eat fresh meats, but I feel like I get everything I get from that if you really work as a team, especially as a whole family, to eat completely well-balanced diet, avoiding the processed foods. I feel like I get everything I need.
Yeah, I agree with that. I don't use. I did a lot of supplements in medical school. I realized most of them are probably just expensive urine in my toilet. So I've moved away from most of them. There are a few that I think that I love, like glutamine. For whatever reason, I've been a huge fan of for a long time. Whenever I get sick or just day in and day out, it's a supplement that I feel like I lack just because of the intensity of the workout and the intensity of the stress on my body. And then recently, I've read more about L-arginine, and I feel like the vasodilation aspect of it, the fact that it helps with your gut and your brain and all those kind of things. That's something I'm looking into to see if I need to. I mean, I don't think I need it as far as like proteins go, but just something to add to the roster. At your age, how old are you now?
43.
43. You look fantastic. You have better hair than I do. Well, how do you train how do you train? What's your workout schedule like? How do you maintain the physique that you have?
You know, I could be better than I am now. Somehow when I reach 40, working out is just not as fun. And so I try to stay disciplined. You know, you can always say stay disciplined. So I do have a bike at home. And at the very least, when the kids are in bed, I try to get on there for 30 minutes and put on a show. And it's better than nothing. Lately, I got invited to join a weekly basketball game. My partner, who's an orthopedic surgeon, has got a weekly basketball game. And so I've been doing that, and that's some motivation to do something fun. But I think at a certain point in your life, when you got to put the heavy weights down, you got to find something else. So I'm looking to play sports, get in the pool, maybe get back to some old sports like tennis and things. That's what I'm looking for now.
That's fantastic. Let me ask you some, before I do the rapid fire question part of it, let me ask you one last question that I love asking, especially physicians who are a little bit more apt with technology. We hear a lot about artificial intelligence coming into medicine, coming into surgery, as well as the healthcare aspect of it, insurance, and then, OR operations, hospital management. How has it impacted you so far? Are you using any of those robotic assisted devices? Where do you see artificial intelligence playing into the field in the next 5 or 10 years? And what's your experience with artificial intelligence in general?
So as far as robotics, I don't do that much. And believe it or not, the clinical results for robotic joint replacements have not been that impressive. The x-rays look amazing. You put the implants exactly where you want it. But studies are showing that those old school guys just doing it by looking at it with their eyes and their hands did a really good job. And clinically haven't made that many improvements with robotics. And when it comes to AI, I don't think it's going to impinge on medicine. I think there's such a doctor shortage. What it's going to allow us to do is maybe take away some of the routine things. So a lot of pathologies that we see that are a little bit automatic. Take an ankle sprain, for example, as long as there's no major injuries, no ligamentous injuries that really need careful attention. Ankle sprains can be treated conceivably by a really good AI bot, and that'll free up time for the guy that's got that crushed pilon fracture, that crushed syndesmotic injury. So I think in any field, even fields like radiology and pathology, which you think are going to be immediately eliminated by AI, I don't see that as a problem. I do think it's just going to be offloading the really, really routine normal exams so that the radiologist, the pathologist can just focus on the really difficult cases. I think overall it's going to help medicine.
I tend to agree with you. I have made videos in the past where I've said, I think the next 10 to 15 years might be the golden years for physicians in general when it comes to even for radiologists, pathologists, in anesthesia and orthopedics. A lot of the busy work or a lot of the routine algorithmic type of treatments for disease processes, or even just, when you when a radiologist goes into work, just organizing them by most acuity or whatever it is, or even assisting in the sense that, hey, you should look at this, 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 and this and make a decision, or this is what we think it is. Is it true? Or being supervised almost in a sense. I think the next 10 to 15 years are going to be the golden years to be a physician. For the next crop of, kids in high school right now, it's a little bit more murky as to what medicine evolves into in like 20 years, 15, 20 years. But I think for us, it's going to be fantastic. It's going to take a lot of the busy workout, as well as on like the documenting side. Like, I don't know about you, but a lot of the surgeons here in Pittsburgh, they have a little chat bot that they go into the physical exam rooms with, and they just put it on, and then, or I guess it's always on, I don't know, and they have a conversation, they do their physical exam, they just talk out loud that, hey, your lungs are clear or whatever. And then they go out and they plug this thing in and they say, generate me a level 3 note. And it cuts out all the nonsense that you talked about, like the weather or the sports teams. And it generates you a note that hits whatever billing cues that you need. And it has saved these surgeons almost like 6 to 8 minutes afterwards per patient. Now, if you multiply that over, I don't know, 20 patients, you're looking at almost 120 minutes saved. It's like 2 hours of time that they get back to do whatever it is, see more patients or go home early, or, have a life outside of medicine. I think that will be the first wave of how it's implemented in healthcare in general, is cutting out a lot of the busy work that has been accumulating because we have to hit these certain data points when we see a patient or when we do a procedure or whatever we have to do to get the RVUs or get the insurance reimbursement or whatever it is. So I think that's my opinion, the first step, but you're right. I think it'll make a life a lot easier for a lot of different specialties out there.
Yeah, no, I totally agree with you. And I think who knows what's going to happen. I mean, you probably remember the time before computers were hooked up to the internet. I remember my first computer, we did not have internet. And then we got this dial up. And so we're going from the beginning of our lives with computers that not talk to each other to now we have artificial intelligence. It's really an incredible time we're living in right now.
They say technology is exponential, right? The logarithmic, exponential. It just goes up straight into the right. So it's pretty insane time, and I think it's going to be awesome for the next generation. I have made it a point. I'd love to hear your opinion on this. Your kids are 6 now, you said, right?
Mm-hmm.
How are you setting them up for the age of artificial intelligence? Like when they get to high school, are textbooks going to be obsolete? Is it just going to be these like ChatGPT and Gemini and these kind of things have the entire history and education and chronicalized and compartmentalized into these apps. You can get an answer to anything from these apps. How are you preparing your twins for the future that they're going into?
Right now I'm in denial about them growing up in general, but it is something that I don't know how to solve. If you ask ChatGPT right now to write an essay on Catcher in the Rye, it'll write it in 2 seconds.
Yeah.
So I really don't know as a teacher how they would navigate that. Me and my wife both agree, in general, screen time is not good for our kids. So we're going to try, with the help of our school, to keep them off their phone till at least high school. We're going to try. I don't know how successful we're going to be, but we really try to focus on getting outside, playing sports. I purposefully read books now. I was reading my Kindle app on my phone for years and years for the convenience, but I purposefully have bought books now, physical books, so my kids can see me read and see that I enjoy reading, and hopefully they'll pick that up.
Yeah, I appreciate that. I think you're absolutely right. I don't know how they navigate it, because back in our day, and I don't know if this was in your day, but in my day, when we wanted to quote unquote get some help on a book assignment, we would use this website called Spark Notes, and it would summarize every chapter into like one page, which you could read to kind of understand what happened in that chapter. Now these guys can just type it into an app, and it'll make a movie out of it. It'll make images out of it. It'll do everything. So I don't know how you navigate that. The one tip that I've been doing well is that I've allowed my son to use his imagination to create images on ChatGPT to kind of spark some curiosity, so that he can at least be a little bit used to using the apps and their capabilities and not be kind of blindsided by it when his peers are, they know, like you said, they know everything that happened in Catcher in the Rye while he's behind. So I kind of started that a little bit, and I don't know if that's a good thing or a bad thing. I've kind of, it's a very, very gray area, but I said, hey, at least you can use your imagination. Like you want to draw a dinosaur on a skateboard in the ocean with a rocket ship, let's do it. Let's see what comes up at you. So that kind of thing to foster a little bit of creativity around it. And I don't know if that's where the future goes with this thing or what happens, but that's kind of how I've been doing it.
Hey, how old is your son?
4.5.
4.5. Yeah, that's amazing. And I had this guy I went to high school with who became a quadrillionaire because he loved playing video games, and he programmed some platform that helped people play video games.
Wow.
So he coded this program. So by the time he was in college, he sold his company to Amazon or someone for hundreds of millions of dollars. So I have a feeling that a lot of kids are going to be really good at AI, and they're going to make a whole career out of it. So
Yeah.
that's the other impossible side of parenting. Are you limiting your kids by taking away this maybe advantage of working with computers, working with AI? I don't know. Parenting is something that we make it up as we go, and we just do the best we can.
Yeah. Yeah. And everybody's just doing the best that they can. Let's do a little rapid fire before we end this. I want to ask you first, favorite orthopedic procedure to do?
Say total hip replacement.
All right. And favorite place to vacation?
My initial answer is staycation, but the best vacation probably I ever went on was me and my wife went to Turks and Caicos whenever we had our first year anniversary, and that was that was a good time.
I'm messing up the rapid fire questions, but we went to Korea a few years ago, and we climbed. Behind Seoul, I guess there's a mountain range. You probably know the name. I don't know what the name is, but we climbed up that mountain range. I thought that was one of the most beautiful places. We went during sunset, and that was probably one of the most beautiful sunsets I've ever seen. And when you said Turks and Caicos, it reminded me of it because I tend to love the beach as well. But the only place that I've been to so far in my life where I was like, oh, I really like climbing a mountain and looking over the city was in Korea. And so, yeah, do you know the base I'm talking about? There are mountains that I'm talking about.
I do.
Is that on the beach? I don't even remember. But there's like an army base up there too, and something else. And it was awesome. It was such a cool experience. We did it with like an Airbnb guy who took us on a hike up there, and then came back down, and it was amazing.
Oh, that's great. I mean, I'm Korean, but I'm probably the whitest Korean that exists. I don't even speak Korean. Don't know anything about Korea. So sorry, Mom. Sorry, Dad.
Yeah. Favorite? I guess we should continue with favorite food then.
Favorite food?
You
Guilty
gumbo guy.
pleasures gotta be cheap Chinese food. I just love it. Terrible for you, but once in a while I gotta do it.
Yeah. Favorite sports team?
Do I go Saints or LSU Tigers? I'm gonna go Saints because they're the underdog this year. But I'm gonna put my.
Did you go to LSU?
Saints. Did go to LSU.
Okay, yeah. So tell me a little bit about that experience, man. I've always wanted to go to an SEC school. It just seems like such a cool place to do your college time. How was that experience at LSU? I know it's an amazing, amazing institution.
Yeah, I always took it for granted growing up in Louisiana that not everyone has that. I was there when Nick Saban first took the job. So that transition when LSU was kind of a middling average team to bring back the magic. And great story I have about being a music major at LSU during football season. We had 2 music buildings, a new one and an old one. I liked practicing in the old one because it was always empty. One Saturday in my freshman year, I'm there practicing my violin because, that's what you do. You practice every minute you can. And I hear this ruckus. And I learned that day that the LSU Golden Girls, the dance line, uses the old music building as their dressing room. So I found out that accidentally. One of the little perks of being a music major in the late 90s, early 2000s at LSU.
That's awesome. That's a great story. I can only imagine what it's like to be at an institution like that and be a music major because it's a very funny situation. It just made me think of a question that I'd been asked before. You're on social media now. You were a violinist. You ever regret going into medicine or being a doctor?
That's a terrific question. If you asked me at any point in my medical training to repeat a year, I would have quit. And if I had to be completely honest with myself and everyone, I don't know if medicine was the right choice. I've reached a point in my career where I'm really grateful for the skill set that I have, and I really feel like I'm helping people. But it's something that you commit to, and there's no way you can know exactly what you're getting yourself into, especially when it comes to surgery. So if I could give someone advice, try to go into it for the right reasons, which means don't go into medicine to make yourself feel better, to make yourself feel worthy of anything, or to make your resume look better. You need to go into it for the reasons that I honestly didn't go into it. I went into it because I thought the ortho guys were the coolest, baddest dudes in the hospital. I also went into it because I thought it was just this really difficult thing that would be great to accomplish. Even though I got on the other side of it, there was a lot of heartache in between. To be honest, I have thought many times about not doing this anymore. But overall, after doing this for 10, 12 years now, I am happy to do it. Charles Barkley, the great Charles Barkley, has this great saying that there's only 5 real jobs. There's police officer, teacher, firefighter, member of the armed services, and people that work in healthcare. And so if Charles Barkley is any indication, we at least have one of those 5 jobs.
That's so true. I actually really appreciate that answer. I echo the same sentiment. So, and that leads me to my final question, Dr. Kang. And I tend to ask this, actually, I do ask this to every single person who comes on the podcast. When I was 24, when I was 24, 25, applying to residency as a medical student, it was probably the most anxiety-filled 6-month period of my life. And at that moment, I really wished somebody in my field, there's one of my colleagues or somebody I looked up to, would give me a little bit of advice to help me navigate probably the most tumultuous, 6 to 12-month period of my life. Looking back at it now, if you can go back to your 24, 25-year-old self, what advice would you give?
I would give myself this advice, but I probably would not have listened to myself. I would have said, just get lost, old man. You don't know what you're talking about. But I wish I would have been able to convince myself that your self-worth as a human is not determined by what you match or where you match. You are valuable and worthy just who you are. And no matter what kind of doctor you are, no matter where you train, you're going to help people and you're going to be happy. So if you pick a field based on ego, by what might be cool, what you think would be cool to call yourself later, you're not doing yourself any favors, especially if you actually get there, especially if you gain that. So, I'll tell you one story of someone who I think did it right. So this person was convinced she wanted to do gyn-onc surgery. She loved it, had some great mentors, and was applying to OB-GYN. And at some point late in the process, in 4th year, realized I actually don't want to do this for the right reasons. I just like the idea of being a surgeon. I like the idea of being in charge and picking the playlist in the OR. And she changed at the last second and went into internal medicine, went to hematology oncology, loved her residency, loved every day of her fellowship, and then now is a wonderful oncologist, hematologist, and every day goes to work generally happy that she chose that field, and I think it's a perfect fit for her. And the reason I know that is because for some reason, which I still cannot explain to this day, she decided to marry me. So do it the right way, pick it for the right reasons, and you are worthy no matter where you go or what you do.
I love that. I absolutely love that. And I love that to bookend the end of the podcast. Dr. William Kang, thank you for taking the time out of your busy day and making, giving some great advice, some sage advice that I'm going to absolutely clip and put on social media. Where can everybody find you? Can you let everybody know about your Instagram handle, your TikTok handle? If you have a YouTube or a Facebook, let us know.
I only am active on one social media, and that is Instagram. It's willkangaroo.md. I put Will Kangaroo because there's millions of Will Kangs out there, but there's only one Will Kangaroo. That's where you can find me. No TikTok, no Snapchat. I have a small YouTube channel, but it's got almost no videos on it.
All right, well, we got to get him some more followers on YouTube, and everybody go follow him. His videos are absolutely hilarious. And honestly, and for anybody who's watching this, I've come across maybe, I don't know, let's say 5,000 to 10,000 surgeons in my career. And you can always tell who's in it and who's genuine and who is not. And Dr. William Kang, after speaking with you today, I can fully endorse that you're one of the surgeons that I would trust my family member with just from meeting you and talking to you today. So thank you so much for taking the time out and being on the podcast.
Great honor. Thanks for having me, and look forward to seeing your videos too.
All right. Well, thank you guys for tuning in. And if you can, please like and subscribe and do all the things. We'll see you guys on the next one.